Welcome to the first video in our TOPMEd series. This video is an introduction to the medical team. Team-oriented medical care stresses that the physician is not alone in caring for the patient and should recognize and come to rely on other team members in providing optimal patient care. As a physician, it is good practice to be familiar with the roles of team members and how they help you deliver the best care. All of these roles may look different in different clinical settings. In this video, you'll be introduced to common team members you may encounter at your clinical sites. When you are at your primary care office, introduce yourself to your team members and discuss everyone's function in the practice to better facilitate teamwork. Today we are going to follow a patient, Jenny, during her doctor's appointment and learn about team members. Let's get started. This interaction likely starts before Jenny even arrives. Jenny may call in for help with an acute problem. A nurse would triage the presenting problem, determining if and when an appointment should be made. If a visit is warranted, the triage nurse may transfer Jenny to a scheduler to arrange an appointment. The front desk staff is usually the first member of your team that the patient encounters on site. Their duties may include helping with insurance, payment, scheduling, and getting the correct forms ready for the visit. Also on the administrative team is the billing staff. They may help check patients in, but their primary duties lie with billing and insurance. Who is the most important member of the team? The patient. When it comes to treatment success, compliance with a plan is complex. To achieve the best outcomes, the medical team must consider the patient's personal challenges, whether they be socioeconomic, physical, intellectual, or emotional, and their motivations and beliefs. Also important are friends and family and other supporters who can have an enormous impact on the course of care. Keep in mind that everyone's definition of family may be different than yours. The next member of the team is the one that walks the patient to the room. This can be either a nurse, a clinical assistant, or a medical assistant. The role of a nurse is to provide and coordinate patient care, educate patients about health conditions, and provide emotional support to patients and family members. Their duties may include greeting patients and bringing them to the exam room, or doing triage as we saw before. Here, this team member is a certified clinical assistant. Clinical assistant's duties may include administrative and clinical tasks, including walking the patient to the room. In many states, no formal training is required to become a clinical assistant, though official certification can be obtained to become a certified clinical assistant, as we see here. Within the first few minutes of arrival, the patient has already encountered 3 or 4 team members. You can begin to see how many people are involved in successful and efficient medical care. The next member of the team to talk with the patient will usually help gather information, including the reason for visit and vital signs, and prepare the patient in room for the visit. This may be the same member of the team that walked the patient to the room, or it may be another nurse. At this point, the physician, physician assistant, or nurse practitioner sits down with Jenny to discuss her health and the reasons for her appointment. Physician assistants and nurse practitioners are medical professionals with graduate level or advanced training who are licensed to provide comprehensive patient care to the limits of their training and state regulations. Duties for both include diagnosis and treatment plans. The difference between the two professions is based in training philosophy. A physician assistant is trained in the medical problem-based model, and nurse practitioners are trained in a nursing or wellness model. In a primary care practice, there are often no overt differences. You will likely work with both in the clinical setting. The doctor is the leader of the medical team, and this appointment is running efficiently because of the amount of work put in by the team beforehand in making sure the office runs smoothly. Depending on the appointment, the visit may end here. More likely, though, is that the doctor will call in other members of the team for help in Jenny's care. If lab tests are needed, a lab tech may get involved in collecting the samples. Here, a certified clinical assistant is drawing the sample. If the physician determines that the patient needs an immunization, a nurse or clinical assistant may return to administer the injection or perform other tests. Jenny may be having trouble coping with a condition or situation, and her physician may feel that she would benefit from additional support. Many practices now employ a mental health clinician or work with a clinician in the community. These clinicians are usually psychologists, social workers, or counselors who have some level of mental health training. If Jenny needs to alter her diet for treatment or rehabilitation, a dietitian can get involved. Dietitians and nutritionists are experts in nutritional balance, specific dietary limitations, and successful plans and programs. There are a number of other team members that the doctor may involve in Jenny's care. There could also be a referral to a subspecialist for further diagnostics and treatment. Some clinics may have dental care on site, and if Jenny were in need of dental care, she could see a dental hygienist during her visit. Patients with physical complaints often benefit from guidance from a physical therapist. A physical therapist may be on site or may be in the community. There are a myriad of community resources such as Alcoholics Anonymous, senior centers, visiting nurses, to name a few. There are a lot of different models and a lot of different resources, and you should find out what the resources are within your community. Once the visit concludes, Jenny would check out from her appointment with the front desk staff. If her physician made a referral, a scheduler or other member of the front desk staff may help schedule an off-site appointment. Billing likely occurs at checkout as well. In your training, you will find different team members at different clinical sites, and some of the team members may perform roles slightly different than those described here. That's typical. It is your responsibility and your role as a physician and member of the team to learn and understand different team members, their roles, and how they can enhance patient care. And that concludes this introduction to the medical team. Please reference the online TOPMEd glossary when trying to learn and understand the roles of various team members. But never forget that the easiest way to understand a team member's role is to simply ask them.